types. Alright, so we'll talk about types of damage to the heart valves. Okay, types of damage to the heart valves. So we are looking at temporary and what permanent damage to heart valves. So this is actually based on duration. It's based on duration. Okay, so we'll talk about the temporary ones also. The temporary one is just the valve function is impaired but can improve, okay, once it is treated. I don't know if you understand. So it's temporal. If you treat it, it goes away. Okay, so examples, we have the infective endocarditis at the early stage. Inflammation and infection can cause swelling and dysfunction, but once you treat it well with antibiotics, the function of the valve can return. Then we have another example like myocarditis or rheumatic fever. Inflammation can cause temporal valve swelling and regurgitation, but if you treat it well, the valves can actually return to their normal function. The functional regurgitation is when there is valve leakage due to dilation of heart chambers. You understand? So if the chamber size normalizes, the valve function also returns to normal. So all of these are examples of temporary damage to the heart valves. There's sometimes there's a damage to the heart valves caused by medications or metabolic causes. So some drugs or electrolyte imbalances or all of that. You understand? So once you withdraw the drug, or if the electrolyte imbalance stabilizes, the valve comes back to its normal shape. Then for the permanent damage, this one, there's structural damage to the valve leaflets, okay, the chordae tendineae or the annulus, and you can't just reverse it. Okay, examples, we have rheumatic heart disease that is chronic. We have advanced infective endocarditis, of course, that's chronic infective endocarditis. We have degenerative valve disease. We have the congenital malformations. We have radiation, that's heart disease due to radiation, or we have the carcinoid heart disease. So that's what we have for these types of